John is a 63-year-old male. He presented with recurrent severe respiratory infections during the last year. During the last 6 months, he presented with a gradual onset of generalized weakness, fatigue, myalgia, and anorexia. He self-medicated with intramuscular analgesics, developing abscess of the left gluteal area. The patient has a history of hypertension for over an year, which is currently managed with atenolol 100 mg a day. He had a history of a stroke without neurological damage or motor deficit about 2 months ago, and along with that he has had pneumonia with 2 occasions that required antibiotic coverage and hospitalization for more than 21 days. The physical examination shows vital signs with the heart rate of 71 beats per minute and regular. Respiratory rate is 18 beats per minute and the temperature is 37 degrees Celsius. Throughout his hospitalization, anemia and kidney failure were found without apparent cause. Wide antibiotic coverage was used without signs of improvement. The patient was transferred to the university hospital where, under the criteria of recurrent infections, pneumocytic anemia and kidney failure, metastatic series imaging was sent. The skull X-ray showed lytic punched out lesions. Now, the questions to ask are, what diagnosis is suggested by these findings? How will you treat your patient? What are the treatment options available for this particular disease? To learn the answers of these questions, let's study the multiple myeloma in detail on sqadia.com.